Time to check in with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19. Here we are a year later. Happy Friday.
Yeah. Happy Friday. Do you remember we were in studio together a year ago?
Yeah, that's right. Yeah. And we've gotten to know each other quite well since then. I didn't think I'd spend this much time with epidemiologists. Yeah, it is amazing where we're at, though, a year later, right?
Yeah, amazing, right? Like, we've never had a disease in history where a vaccine campaign has come in during a pandemic. The influenza vaccine was 30 years after the 1918 influenza crisis. This is the first time in history we're stopping a pandemic with a vaccine. You need to reflect on that. It's amazing.
It's so historic, and yeah, that is pretty epic. Now, in our news today, of course, public health units in Ontario are rescheduling that second dose. I wanted to ask you this. There is a school of thought that those who have had COVID-19 only need a first dose. Your thoughts on that?
Yeah, so 4 studies actually that are now peer-reviewed, where they looked at people after getting their COVID-19 and getting a dose of vaccine, compared them to people that just got the typical vaccine series that never had COVID-19. And their antibody levels after the first dose for people that have had COVID-19 are the same as people who have had 2 shots who have never had COVID-19. And the theory makes sense. You know, these antibodies prime the immune system, and these vaccines prime the immune system, then boost the immune system. And so having your natural COVID-19 might just be the prime, and then getting the first dose of vaccine is the boost.
Right.
It definitely needs to be considered. France is doing this now. And if this is really true, I mean, we should be instituting this. That's 500,000 doses for all the Canadians that have had COVID-19 that we can take back and give to people who haven't had COVID-19.
Absolutely. Yeah. So do you think, is there traction on this, or?
Yeah, a lot of countries are looking. I think NACI is starting to look at this as well. And again,
but in Canada?
Probably hear about it. Yeah. Like our own federal organizations are starting to look at this data. Hopefully, again, this gets sorted out, because again, it is a great way to save vaccines without necessarily compromising anything.
Yeah. AstraZeneca in the news this morning as well, because some European countries have put a pause on it. There was a case of blood clotting. Health Canada has jumped in on this. I want you to.
Yeah. So again, this is normal in the course of vaccines, right? We give millions and millions of vaccines to people. The things that happen in millions and millions of people's lives, even the rare events, are still going to happen. The vaccine doesn't prevent them. So I could go to work and get into a car accident. I could get hit by lightning. I'm not going to attribute that to the vaccine. When these events do happen, though, the regulators take a look. They make sure that these are just natural events that were destined to happen anyways, and that these aren't, people where it seems to be very tied with the vaccine itself. It's important for Canadians to know there is 20 million doses of the vaccine administered between the United Kingdom and India without a signal towards this. Our supply actually comes from the Serum Institute of India, whereas this implicated vaccine supply is from the United Kingdom. And so, again, for those of you who are in line to get a vaccine, get it today. Get the AstraZeneca. The supply we have is good, and Health Canada has no concerns with this review.
Okay. We've learned this week that with pregnancy, it's fine to get a vaccine. But I want to ask you about cancer patients. Any concerns? And is protection impacted with a cancer patient?
Yeah, so this is emerging. Obviously, we know patients with immune-compromising conditions, major immune-compromising conditions like cancer or organ transplants, do have subadequate immune responses. There is some data emerging from the United Kingdom about the Pfizer vaccine. It's not peer-reviewed yet, just released in the press, that suggests that the responses to the first dose of Pfizer aren't adequate, and about 30 to 40% make antibodies as compared to 97% of others. And so it's something we have to monitor. If we do see this trend, that this group may have to be prioritized to get a second dose of the Pfizer vaccine.
Okay, so we're at that 40% range right now with the variants. Is there a concern for a third wave here?
I think we are seeing growth. It's not as fast as we are seeing before. The nice thing as well is hospitalizations are growing exponentially. They are growing, but because the long-term care sector is protected, we're having much less of that pressure. But there is more human-to-human contact. There are more vulnerabilities in shelters and jails and other workplaces, and so it is going to be a bit of a bumpy road for the next couple of months. But hopefully, again, our vaccine campaign, makes it so that whenever this last bit of growth is done, we're back to a place where a huge amount of the population is already immune.
Okay, and you know, it won't be long before we have you back in studio here at Morning Live. And we have donuts, remember?
Yeah, I'm looking forward to it. I'm looking forward to it.
Yeah, all right. Thanks, Dr. Zain Chagla. Have a great weekend.
No problem. Take care.